Hello everyone, this is Anshuman once again, your travel buddy. And today I'm here with my new blog, and this blog is definitely very important. And I'm creating this based on the overall questions people ask me and requested me to create a video about the hospitals and the pregnancy experience, how that's work in Netherlands. So that's the reason I thought let's create a nice video and because we have been through this complete year about all those experience. So we're going to talk about that as well. So 4 or 5 important points we're going to cover, and if those points will not answer your questions, again feel free to drop me your question on the comments. I'm more than happy to answer. As always, I try my best to answer all of your questions. Let me starting with the overall insurance system, right? So in Netherlands, normally there are two types of insurance we have, right? One is a Dutch insurance, and the second one is an expat insurance, right? So Dutch insurance is it's amazing, but few companies doesn't offer that, so that's why I'm just talking about both of them. So the Dutch one, the Dutch insurance, Dutch basic insurance, cover all your hospital expenses, including your GP. As well, if you want to have any issues, anything on you can go to GP. It covers your childbirth. It also covers maternity care, which we'll talk in detail a little bit. So these are all things that has been covered in the Dutch basic insurance. However, if it's the expat insurance, it's a little bit tricky, guys, because in the basic thing, most of the things are covered. I'll not say it's not covered, but most of the things are covered, like your childbirth, your GP, everything is covered. The only thing which is not covered is especially your dental and the maternity care, right? Which you will require after the delivery of a baby, right? So that's where you would require. So that's pretty much that not covered. So make sure if you have expat insurance and if you're planning any baby in future, make sure you upgrade your package to premium so that you don't have to be worry about that and paying yourself from your pocket for maternity care, right? So now what I'm going to do is I'm going to call my wife in this blog, in this blog to so that I can ask few questions which people requested me, and she can share her own experience, what she have been through. So it will be great for you guys to hear from a person who been through with this situation. And again, feel free to ask any question if you have. So let me call. Her name is Pooja. So welcome, Pooja.
Thank you.
Yeah. So.
Hi everyone. So myself Pooja.
So okay, Pooja. So what we're gonna do today is we're gonna do a Q&A, where I'm gonna ask few questions about your experience, how you have been through in Netherlands for your this hospital journey, right?
Okay.
So starting with once anyone gets pregnant, what the first thing the person has to do?
Okay. So if anyone gets pregnant here in Netherlands, so first thing you need to consult with your area midwife. So once you will connect with your area midwife, they will give you some registration form. I mean that will be online. So you need to register yourself first, and from there you can start to consult with your midwife. So it is quite different from India. In India, we reach to gynecologist, but in Netherlands we reach to midwife first.
And you can search in Google which are the nearby midwives,
Yes,
and you
yes.
can reach out, right?
Yes,
Okay,
yes.
perfect. And okay, so after you have registered, how frequent you have to go to midwife and how the checkup works?
So yes, once we will register to any particular midwife, whatever the midwife nearby your place. So the checkups they usually do within a month or after two. They start after 1 month. After that, if everything goes well, I mean there is no complication in your pregnancy, then they will call you in 1 month or 2 months, like that.
Okay.
Yeah.
And then do we have to pay for ultrasounds here, like how we pay in India?
So yes, like there are two ultrasounds which is paid by your insurance. Apart from that, if you want more ultrasounds, then you need to pay.
And what are those two? Like which term that normally you have to do that?
So first ultrasound happens in your first or fourth or sixth week, and second one happens in 20th week. So these two will be covered by insurance. After that, if you want to know the gender of the baby earlier than 20th week, then you have to pay for that. Or if you want to know more about baby after 20th week pregnancy, and you want more ultrasound, then you have to pay yourself by yourself. Yes.
Perfect. Okay. Yes.
Yeah.
Okay. And then if I talk about if anyone has a little complication, how does it work? Still, it will go with midwife, or how does it work?
No. If again, complication will clear with ultrasound. So if there will be complication in second ultrasound, your complication will be clear if there is any. So if there is any complication, then your midwife will refer you to doctor, your the hospital which comes under your area. So in our area, it was AMC, Amsterdam AMC hospital. So my midwife referred me to that hospital with the gynecologist.
Okay, and after you
Yes.
go to the hospital, do you have to register anything, or what do you have to do?
No, because our midwife provided all the documents which they have related to related to my pregnancy or my complication. So they provided all the documents to hospital.
So you don't have to register in hospital to get any patient card or something?
Yes, in hospital on first visit, you have to register yourself to get a patient card. After that, there is no entry registration or something. You just need to carry your patient card to the hospital.
Okay.
Yes.
And if I have any question during pregnancy, whom I can reach out?
So there is a contact number given by hospital. On that number you can call, and if there is emergency, there is again another emergency contact number given, so you can reach out to them on that number. And like hospital time is till 5 p.m. So after that, if there is emergency or if there is any complication happen with you, then you can reach out to again on that emergency number.
Okay, and midwife also has some emergency number, or?
Yes, so midwife also have some emergency number. So they have given name like red team and blue team, something like that. So mine was red team.
Okay, perfect.
Yeah.
Okay, so on the day of delivery, right, before the delivery comes, how it was explained by the doctors that what will happen on the day of delivery?
Yes, so as I mentioned, like I'm not sure if I mentioned or not, there was a complication in my pregnancy. So my midwife referred to me the doctor, and since beginning, a doctor explained us everything, that what is the complication with my pregnancy, how it will go, and what will I have to face in operation theater and everything. Like everything was explained by a doctor, that there could be blood loss, there could be chances of premature delivery and everything. So everything was explained by the doctor.
Okay, and exactly that happened?
Yes.
Okay.
Yes.
So whatever they explained, it went through the same.
Yes.
Okay, what preparation we have to do on the day of delivery?
So if since I went through a C-section again because of the complication, so I carried all my stuffs related to me, like my clothes and everything, and related to baby, like her clothes and everything. That's it. Apart from that, there was nothing, no need to carry anything for the hospital.
Okay.
Yes.
And what is the difference between the normal delivery and C-section in Netherlands, if I call?
Yes. So in normal delivery, so the normal delivery will be done by midwife, not with the gynecologist, if there is no complication again. And if there is complication, it will be done by gynecologist. So normal delivery can be done in 3 places. Either it could be your home, it could be midwife's clinic, or it could be hospital. Whatever you choose, delivery will be happen there. So in normal delivery, you have to prepare yourself with the maternity care box. In that box, you will get sanitary pads, plastic,
Everything
type
about
of blanket.
what
Yes,
you
everything.
need over there.
Yes, you
Okay.
can buy those maternity box from Itos nearby your.
And you also get from your insurance company?
Yes. Again, if it is premium, you will get that part will also be covered. If it is not premium, then it will not be covered.
Or it may be a Dutch basic.
Yes,
right?
Dutch
It will
basic.
be
Yes,
covered
yes,
as well.
yes.
Okay, fair enough. And what is the maternity care? What that maternity care all about?
So maternity care is all about taking care of after delivery, right? So here in Netherlands, maternity care, this is called Zorg, something they call. So it is this service is provided after the delivery. You need to register for maternity care, and after delivery they will send any nurse or something to take care of you for at least for 24 hours. It totally depends on you how much hours you want that maternity care. It could be like 24 hours, 8 hours in 3 days. So this is how it works here. So this is called maternity care. It works after delivery.
Okay, and you will get support from nurses.
Yes.
And will be coming in, making sure they're doing
Yes.
Daily checkups.
Daily
and everything.
checkups, yes, yes,
They also help on households as well, or
Yes, sometime if you will ask them to prepare some breakfast and all, they can help.
they can help as well.
Yes.
Okay, great. Anything else is you specific you want to let the subscriber knows about, which is you feel different from India?
Different from India, yes. As I mentioned, midwife, and if there is any complication, then you will go for delivery in hospital. Apart from that, yes, one more difference. I checked here that after delivery, if there is complication in your pregnancy, and after delivery, when you come home, then from midwife some person will come to check you and your baby, like your baby's weight, her health and everything. For 3 days, minimum 3 days they will come to check.
Okay,
Yes.
that's how, and we don't have to call them. They are well aware by the
Yes,
hospital,
yes,
right?
yes.
Okay.
Because again, whatever has done in hospital, they will provide all the information to your midwife after your delivery.
Okay, and all these things will be covered by your insurance.
Yes,
You don't
yes.
have to pay anything, right?
No, no.
Okay. Perfect. So I believe, that's pretty much. So I really appreciate your time.
Thank
you,
you.
Pooja.
Thank you.
And thank you, viewers. Please ask if we have any. We have not answered any of your questions. If you think in this video, please feel free to put your comment. We're more than happy to help. And as always, please do like, share, and subscribe my channel. And I'll be creating more videos. And I'll see you in my next video.
Thank
Thank you very much, guys. Have a great day ahead.